Thank you, Kylie. I really don't know how I can live up to that now. Thank you, Christine, as well, and thank you to the whole college for the opportunity and for having me here today. It really is a pleasure. If I can just start by acknowledging the traditional owners of the land as well on which we meet and pay my respects to elders past, present and emerging, the beautiful Ngunnawal lands here in Canberra. Just, I guess, context for today in relation to some of the things that have been discussed already. Kylie provided a bit about my background, working in and around the health portfolio for going on 25 years. Do not underestimate how much they do read those policy papers. They do. Okay, the relationships are important. Influence is what we're all here for. Take the opportunities when you get them. I'm just going to start. I realise many of you probably know the agency, some of you even probably work with the agency, but I'm just going to start to give you a little bit of visibility for those who don't know what we at the agency do. I just wanted to, the Australian Digital Health Agency was established in 2016 with a single purpose, same age as the policy group here really, of driving digital health agenda nationally. The agency is co-funded by the Commonwealth and all states and territories and reflects the need for a coordinated approach to the digital health agenda. We have an independent skills-based board that represents many of our partners in this agenda, and that includes your college. And much like the focus of today, the focus for the board and the focus for the agency is influence policy. For those of you who don't know the agency, we are best known for management of the My Health Record, and it's true, My Health Record does take a lot of our time and focus, but it's not the only thing that we do. It's simply one part. A significant foundational piece, I will say, but it is only one part. Building on these foundations, harmonisation and digital enablement of the broader health system is our focus, and currently includes a focus on interoperability through conformance standards, electronic prescribing, aged care and others. All that said, I would like to outline the current state of play with the My Health Record, how it is being used and the changes we have seen over the last few years. Many of these are published numbers, most of them are published numbers. I'm not sure how much awareness there is of them. It's quite incredible the growth we've seen in the last few years. 23.5 million Australians have a record, 98% or 23 million containing clinical information. I don't mean Medicare data, I mean clinical information. There are 4.5 billion documents within the broader My Health Record, an increase of 28% or nearly $1 billion in the last 12 months alone. Of these, more than 850 million are clinical documents including PATH, DI, shared health discharge summaries. Pathology is growing at over 100 million documents a year. There's about 240 million PATH tests done every year, so whilst 100 million is significant, it's only about half. Connections. As I said, as an agency, we started in 2016 and the connections at the time were less than a third. 99% or 9,200 GP practices, over 6,600 pharmacies nationally are connected and using My Health Record. 97% of hospitals, of all public hospitals, 62% of private hospitals are connected. Health professional use of those documents in the last 12 months continues to increase. 4.8 million clinical documents uploaded by one health professional in the last 12 months were viewed by another member of the broader care team to support the patient. But what does this tell us? Connections has grown considerably and in several sectors represents almost 100%, and that's great. But not all, and we need to prioritise connecting the broader care team, including nurses who work in other settings, and support them also with access to the digital tools and information you need when you need it to support the patient. Further, even in those settings with full connectivity, we can see where existing information is being viewed or used by a health professional to inform decision making, which is good, but contributions or uploads to a patient's record is not always following that use. It's not routine, it's not regular, which means the information isn't always available to support the patient in subsequent interventions. But one of the most significant changes in recent history, driven in part by the pandemic, has been consumer engagement. I say in part because it isn't just the pandemic that's been driving the change. We've seen many recent examples, including the 2019 fires, the Lismore floods, driving more and more use. And when people become aware it's available, they engage more regularly and for more routine purposes. Of the 23.5 million Australians that I touched on earlier with a My Health record. 5.3 million unique Australians engaged with their record in the last 12 months alone, up by around 1 million in 1 year. The most sought after patient information for consumers in the last 12 months was pathology reports and medications, with individual views of consumers of pathology reports on their own growing to over 27 million in 12 months, up significantly from the previous year. More broadly, and you'll see on the slide, a significant spike in January 22 of total views, with 13.75 million views by consumers, which happened to coincide with the second wave of Omicron, especially in Sydney, where people had to show test results. The system is used when people need it. The growth, and more importantly, the awareness is providing it is good. And it is important we continue to drive change and capitalise on the awareness. Again, but what does it tell us? Firstly, people are really starting to understand and appreciate the value of access to their own health information. Further, and understandably, they are engaging in it when they need it. We don't expect to see consumers use this all the time. In fact, we hope they don't need to. But they expect to find what they need when they do. The My Health record was never intended to be a primary or principal electronic medical record. It is intended to provide a good summary or overview, including medications, tests of a patient health journey, that the patient can access and control. But it needs to be complete, and further, it needs to be available and contributed to by the whole care team to help them support the patient. 5 years ago, we used to receive questions, even complaints from consumers as to who has access to my record and how are they using it. Pleasingly, we haven't received any of these types of complaints for a long while, which is great. It demonstrates a change in culture, and I think a culture Australia has wanted to see change for a while. But we are now receiving correspondence from consumers asking why information that they expect or know should be there isn't. Patients shouldn't have to continue to retell their story. Their information should be there to support their care by the broader care team when and where they need it. And pleasingly, patients or consumers are starting to recognise this, and they're starting themselves to help drive this change. It is this change in consumer behaviour or expectation that has driven more recent changes in the agency and the recent release of the My Health app. Sorry, Kylie, I had to put in a plug. Which is providing these consumers access to their own information when and where they need it. And if you haven't already, I encourage you all to download the app. Just go to the respective app store, Apple or Android, and search for My Health Gov. Okay. So I provide that for context. As I said, a lot of those numbers are publicly available and you can see them. But really, what I wanted to give you was a foundation for the conversation today. Today's a policy conversation. What are the opportunities in that context for us going forward? I think one of the things that we need to call out or acknowledge is that while digital health, or more specifically digital health enablement, needs to be supported by technology, it's not a technology discussion. In reality, this needs to be a policy discussion about the consumer. We have come a long way over the last few years, but there is a long way to go. And for us to drive digital enablement, we need to make sure the policy settings are right to support its adoption and use through the broader system. To this end, the agency is focused on ensuring the ongoing policy discussion with the Commonwealth and all jurisdictions under the National Digital Health Strategy that we have had in place now since 2017 leads our work plan. If I boil it down to three things, they would be driving connections and the sharing of information to support the patient when and where they need it. This needs to include the whole care team. And in this context, we are working with providers, including nurses, as a key player to expand access and availability in other settings like aged care, but we are keen to expand to more. In short, we need to better use what we have. 2, and in parallel, we need to improve and drive real-time data or information exchange through the use of conformance standards to improve connectivity and use of digital tools. We need to make it easier for you guys to use the systems. 3, continue to transform national infrastructure. We need to move to a contemporary structured data-rich ecosystem capable of connecting systems across settings and supporting real-time access to information for the patient and the broader care team. While there are a number of programs and priorities in the agency's work plan, I won't go through them all now. I just want to quickly touch on 4 specifically that represent steps that we are taking already to address those 3 priorities. Our aged care program of work. Aged care program goes directly to building connections in other settings, expanding to include the broader care team and supporting patients and, importantly, their carers as they transition between those care settings. The aged care conversation is extremely topical at the moment. A couple of speakers have touched on it already today. We want to be there to support that transition. The policy change is the catalyst. Digital enablement can help transform as we go. We know nurses are pivotal in aged care, and the leadership role you take with not just care but the broader coordination of that care in this context. I believe this piece of work will help support nurses, especially as a part of the whole care team, providing greater access to information they need when they need it. The second one is interoperability. The agency's National Healthcare Interoperability Plan goes directly to the need for standards to improve connectivity and drive the sharing of information. Standards is a very important part of the interoperability discussion, and the agency is keen to build on its more recent success with its e-prescribing program and play an even greater role in standards development. We are also working with the Commonwealth Department and other policy partners, jurisdictions included, on how we can better support adherence to standards, driving more timely improvements to connectivity and making it a must-have, not a nice-to-have. The National Health Infrastructure Modernisation Program, that is a mouthful, an ongoing program of work designed to harmonise where possible and connect the broader health system. In a digital enablement sense, and as in the policy sense, we don't have one health system in the country, we've got 8. We are working to harmonise digitally to support the broader harmonisation of the digital health system, and we want to work with all of you on that. Using national infrastructure to better coordinate connections with providers, even jurisdictions, and moving from a passive document repository to a real-time, if not proactive, information exchange will help to reduce administrative burden on health professionals and save lives. Finally, supporting the digital health capability of the workforce. There are a couple of examples here of which many of you are probably familiar with. We do as much in this space as we can, but we'd dearly love to do more. It's important that we don't just improve the technology, it's important that we make sure we're improving the capability of the workforce to use that technology as well. The best tools in the world are useless if people don't know they exist or know how to use them. That's it for me today. I just, if I can, want to say thank you again for the invite. I hope that gives you some insight or understanding of the Australia's digital health journey from our perspective, some of the changes that we have seen recently and continue to see, and some of the opportunities that we have on and over the horizon, build on this progress to date, better support you, Australia's health workforce, and ultimately the patient. Just a couple of comments from me, I guess, at the end, noting the policy priorities that Kylie put up on the slide before. Of the 10 that you raised, absolutely every single one of them affects us as the Digital Health Agency, and we'd love to help you with all of them. When you think them through the aged care piece, standardised terminology. It's a really, really important one. If you actually think about what digital enablement is, digital enablement can be the catalyst for that conversation, can really help to drive a standardised terminology agenda. Remote working, nurse prescribing is another big one when it comes to administration and digital access and end of life. So there's a whole stack of priorities that you guys are going to be grappling with today that we share. Very keen and interested to continue to work with you on it. And thank you again.